Go ahead.
Hello, a very good evening to all of you. I, Dr. Nilesh Balkawade, welcome you for today's session, today's Facebook Live on yet another very important topic, a new topic. Is climate change going to affect your IVF outcomes? So let's try and understand which are the climate change which we are going to have. Of course, it's been proven in literature that extremes of climate can have problems with your gametes and with your fertility. That's well accepted fact. But does the change in the climate from summer to winter or summer to a rainy season, the spring, then to the winter is going to affect the fertility outcomes? We'll go on to summer because it's a common misconception that the IVF outcomes are affected in summer, and that's why we should not do any fertility related procedures, may it be IVF or embryo transfers during summer. Is this true? Let's try to find out. So, what can happen in summer is usually there is a transient decrease in the sperm count, which can be seen during summers, and this is now very well accepted. But however, it has been shown that the effect is only transient, and it is not affecting the clinical pregnancy rate or the live birth rate. So may it be natural conception or IUI conception or IVF conception, the results, or that is a clinical pregnancy and the live birth rates, are not affected even if we see that there is a transient decrease in the sperm count. There is an article published in Nature magazine which says that this was published in 2019, and it says that during summer there is no decrease in the IVF success rates, and therefore IVFs and embryo transfers can very well be done during summer. The article also mentions that the vitamin D levels in both men and women are the lowest in the spring season, and this is the season where theoretically, because of the low vitamin D levels, the success rates or the live birth rates can tend to be low. However, this was seen and accepted that the live birth rates can be low, but it was not significant. In winter season also, it is observed that the vitamin D levels are low. This can affect your oocyte activity because in winter there will be a rise in the melatonin levels and the ovarian activity will be less. Therefore, your AMH levels will also tend to drop in winter. And this is associated with a lower fertility, probable theoretically lower fertility in females. Decreased vitamin D levels in men can also affect their sperm counts and motility. The live birth rate has been shown to be slightly lower in cases of in winter when it comes to IVF, but when it was seen by a statistical analysis, it was not significant. That means we can draw a conclusion that there is no significant difference whether we perform any fertility procedure either in summer, spring, or the winter. So that's an accepted fact now. Now, let us analyze what happens during summer, uh, especially when it comes to the sperm count and the pregnancy rates because of that. So, there's one study which shows that in summer, the sperm count motility follows a U-shaped curve. So, initially, there is a decline, then there is a stability or there is no change when it comes to the pregnancy rates and the sperm count, and then there is a rise. So when it is seen, so usually in the first 2 weeks no change is observed. After extreme heat and exposure to sun and the heat in summer, 2 to 4 weeks after that, there is a slightly decline in fertility and sperm count. 6 to 10 weeks after the exposure, there's no change. There's no decline. There's no improvement as well. So there's no change which is seen in the fertility outcomes. However, 11 weeks after the exposure, to the heat or summer, the sperm counts and the fertility tends to improve. So this is attributed to higher vitamin D levels also, and this U-shaped pattern of fertility is seen in the summer season. So, friends, there is a very high association of myths with this all the seasons. We should understand that uh, although there is a theoretical risk in winter because of low vitamin D levels, there is a theoretical risk of decreased sperm count in summer. It is these both things are not translated into the pregnancy rates being affected either by natural conception or IUI or IVF. So climate change is the subtle climate change in the same atmosphere where you are staying is not going to affect your fertility outcomes whatsoever. So whether you take treatment in summer, spring, or winter, it's not going to affect your results. It's very important that you take treatment on time rather than delaying the treatment, and that's very very important. In summers in India you have vacations, and that's a very good and ideal time to de-stress and take treatment, because this lower stress levels are also going to improve and augmenting your fertility outcomes. So that's the thing. Other things which are related to the climate change can be the lab parameters. So lab parameters needs to be properly maintained whenever there is a climate change which is seen. The nowadays with all the labs being the modular labs, and we have all the pressure and temperature control, the climate is least likely to be affecting the results of a IVF lab. And that's very important when you choose your IVF center to see whether the lab is having these controls 24 by 7. So usually we at Oasis Fertility function 365 days a year, and we have annual maintenance for these labs where the labs are closed. But during that time of maintenance, we don't undertake any IVF cycles, and it's very important. So we are the monitoring, air monitoring, the temperature and the pressure monitoring systems are always on when it comes to a IVF lab, and this standardization has to be maintained so that there is no effect of climate change whatsoever on your IVF results. And this is strictly followed so that we have our results at par. The change in climate is not going to affect your results when it comes to the IVF lab. Once that lab is properly maintained, the QA/QC of the lab is properly maintained. So that's it for the climate change affecting fertility results. I hope I was loud and clear to give my message on the climate change. That's it from my side. If you have any queries related to fertility outcomes or fertility treatments, kindly log into Oasis webpage, or you can use the helpline number which is given and have a direct conversation with me or with any of our doctors. You can to reach out physically to any of the Oasis centers here in Pune. One is at Dynasty Commercial Wakad, and the second is at Arisa Avenue, Kharadi. We are ready to answer any of your queries. Uh, Thanks. Goodbye for now. Here's your host, Dr. Nilesh Balkawade, signing off from today's AP Live. Thank you.